Good evening, everyone. I'm Leslie Adamy.
I'm Mike Gillespie. At the top tonight, it has been just over a year since the state of Texas saw a historic resurgence in cases of the measles.
The outbreak began in Gaines County in West Texas. But since that time, the vaccination rate for some students has seen a slight uptick. Our Josh Maxwell spoke with local health experts and vaccine choice advocates to find out what these stats mean for the future. He joins us now in studio with more. Josh.
Leslie and Mike, many families are already planning for their students to return to the classroom. And while some are starting to look deeper into the purpose of vaccinations, others say they just want to make sure that choice remains in the hands of parents.
It was sad to see.
Dr. Eric Baggerman describing his initial thoughts when he heard about some of the lives claimed during the historic 2025 measles outbreak.
I was speaking with some folks about it, and that's when they let me know that that was when the first child had died.
According to an article from the Texas Tribune, the state is now seeing a slight increase in vaccination rates for kindergarten students. But even with what he sees as positive growth, Baggerman says there's still room for improvement.
If this outbreak, raised enough awareness to increase the rates of vaccines, that's great. I don't want to have to see anyone die just to bring up the need for vaccines.
Carrie Bigford with Texans for Vaccine Choice says there are multiple reasons why families may be skeptical about vaccinations.
Be a lack of trust in the vaccine program after COVID. That's another really common thing, is people are disenfranchised by that program.
Regardless of the reason, there's one misconception Bigford wants to clear up.
We are not an anti-vaccine organization. We support your right as the owner of the body or the steward of your child's body, to choose.
Bigford says that the topic of vaccination is a conversation with many layers.
You can be a person who chooses to get a lot of vaccines, but there can be one vaccine that doesn't fit your family. Maybe their child had a mild reaction, so they're waiting 6 to 12 months to continue to vaccinate. There's so many reasons why someone would want to have a more nuanced discussion.
Both Bigford and Baggerman say that the common thread in all of this is education. Both believe that parents should do extensive research into the topic to decide what's best for their family. Back to